Summarized view of a paper, a public platform for virtual IoT-based monitoring and tracking of COVID-19. Part 1. First abstract. The world is developing an app that that alerts a user by using smartphone when the corona confirmed patient is comes near to that particular smartphone or a user. However, the regardless of what what will be put to a practical use first, the tracking system should satisfy the very critical and very uh, important issues, such as issues of legislation of location tracking, and then scalability is another issue for the public platform, because it is used by worldwide users. Additional problems needs a solution related to real-time authentications for public information gathering, blind naming, privacy concerns, and lot of latency issues, like the quality of this query and response procedure should be very good, and the latency between query reply procedure is very low. For this paper proposes a software defined networking controller centric, a global public platform to monitor and track information for COVID-19 relevant for the people, to provide a real-time information disclosure service to the worldwide uh, disease center for disease centers for disease control and preventions, and the normal people, public, because we need uh, to prevent the pandemic using the information, because it is an information era. CDC control a list of people who needs to be monitored related to COVID-19 and forcefully install COVID-19 virtual Internet of Things nodes. We said VIoT in the form of application on their smartphones, because everyone has a smartphone in nowadays. In addition to these nodes, a virtual IoT sports support nodes also engage as information providers to provide the quality of information services. The design of our platforms aims to ensure the confidentiality authentication service, giving a individually different secret key. In addition to that, platform meets a system scalability and reduce the latency of query to the response, and where the platform accommodates a large number of worldwide CDCs and the persons in control per CDCs. First, start with introduction. What is Why this paper should be important? Why we need this? The worldwide is the worldwide pandemic is major concern nowadays. For that, the world is now developing an app that alerts on smartphone when the COVID-19 patient confirmed COVID-19 patient comes in within 5 meters of it. This application use the technology of either distributed or centralized, because generally there are two ways to make a app, either a centralized or a decentralized. It is it is difficult to participate in different distributed warning networks, like, because it is a very hectic to have a both in the same at the same time. That's why it is very hard. So first we look the distributed method. Placing a decentralized application on the smartphone means I am participating as a member of the distributed warning network as a node. The download one of the distributed warning network system package via the web, install that particular application, and find and connect to at least one of the other node belonging to that particular uh, decentralized network, to become a member node of that group. Suppose that my smartphone has joined and a configuration node as a configuration node of the distributed warning network as a node A, to see if there are any COVID confirmed cases around me. Hit corona keyword and and my current location and the corona keyword information. Then a node is send the query message to nearest neighbor node. Upon receiving this message, the nearest neighbor node first searches through the information it is holding, then informs the node A of corresponding one, if any, and then sends the query request to another node. This query message spreads as the wave spreads by repeating the same process again and again, by hopping from one node to another node, and and querying rely on query and response system. As a result, this query message spread to the thousands of messages, thousands of smartphones, which gives the node A the relevant information about the confirmed cases nearby to it. And other ways, the key here is how to handle the source of information. A person who is a COVID-19 confirmed case, who informs himself as a location as has a problem participating in this distributed warning system and acting as a source of information provided. On the other hand, the operation of the on the other hand, the centralized application is smooth. In particular, it is easy for the government to manage a large number of computer, keep track of the all confirmed cases and their particular location, corresponding particular location. If any person wants it, the central computer is ready to provide the information in the form of the client server type web service. Like generally we use the web API for this. It has the advantage for the centralized application to establish the database dealing with the centrally forced COVID confirmed list and their current location information. However, the privacy is a major concern, and there should be the centralized approach which preserve the privacy of an individual person. The Apple and Google jointly developed the app which prefers the distributed method given in the reference 5. There is another approach which is developed by the European Union, and can be can which is a centralized approach, and it is given in the reference 9. We will see that when we put the first use in this paper places a point on the following 7 issues: how these entire service of worldwide COVID tracking should be work. Here this paper uh, summarize the 7 of them to use together. The first is the legalization of tracking a location. Well, countries like South Korea have they unveil the full moving line of the COVID confirmed cases, which surprised the entire world health experts. As in 2015, there is MERS, same MERS virus spread in South Korea, which is from learning from that particular virus, South Korea implement the tracking of infected patient, and legally, because they may without the consent of the patient. And this paper is based on following legal aspect. This CDC manage the list of the people who needs to monitored and related and forcibly installs a virtual IoT systems, virtual IoT nodes in the form of application to their smartphones. The second point is public platform used by the world. There are a lot of organizations and lot of managements are or governments are there which uses their own secret control. They uses their own techniques to control and hide some of the information, and which is failed to prevent or overcome the COVID crisis. The secrecy and authorizationism may may be useful in preventing the explosive distribution of the false information, but they cannot contribute to the spread of virus effectively. Therefore, the transparent and open CDC should manage the infected suspects. However, they still make sure the tracking of information publicly and locally, individually. Consequently, it is necessary to build a global public platform that can capture them. Third point is real-time authentication and reliability of the information. The countries and cities like Hong Kong, Singapore announces fewer than 100 COVID confirmed cases. There was a civil unrest. However, there has been no such situations happened in South Korea despite of the large number of COVID confirmed patients. South Korea had maintained a social function even when the numbers are infected reached their peak. The reason for this is that the South Korea's CDC has given the detailed and transparent briefing on the information, giving them a confidence that they are in control of the situation. However, they give the intelligence briefing once every 24 hours and as frequently as they can. The background of this releasing information of 24-hour has a frequently 24-hour is the product of offline newspaper era. Nowadays, we need a online real time information which update very regularly, less than let's say 24 hours. And whenever an ordinary user requests the information they need, they should receive the service of information of that information as fast as possible, and it should be reliable for that, and it should be proven to be a real time. And the third is blind naming of infected person to prevent the privacy of the confirmed patient. There are the technique should enable particular a technique which will hide its real identity. Like the blind ID enables one to prevent the hackers from interfering the identity information corresponding to this number, even they secretly obtain this identified number. Then it should have the confidentiality, the privacy information of the confirmed cases. The person suspected of infection or a person needed to management should be encrypted and stored using the secret key that is generated separately for each individual. With the large number of CDC and distributed around the world and enough people to manage per CDC, the platform should provide the security management service that allows individual to use different secret keys for each individual. And other part is scalability. System should be scalable. That means a system can accommodate large number of people very smoothly, because there are a lot of CDCs, and each CDCs have a lot of confirmed or suspected COVID patients. So it should satisfy the data structure which can handle the scalability, and should be very simple and straightforward. And the last one is the latency, because when we want to query, so we want to query any information, we need a quick reply, not that if we want if I query today and then I will get reply after 2 hours or 3 hours. We want quick reply. Currently, the person get the global figure. Currently, anyone can get a global figure of the COVID cases on the data which is provided by WHO, the World Health Organization. In addition, they usually get non-global COVID cases trends based on WHO data. However, it takes a time WHO to gather the reliable, comprehensive data. It should be also go beyond the official statistical data presentation method. It is necessary to send a query of an individual and individual basis and reply and receive a reply information in a real-time basis. And this paper proposes a software-defined networking controller-centric global public platform to monitor and track information for COVID-19 relevant people who are infected, suspected, or and provide real-time information disclosure services to worldwide CDCs and regular users. The design of our platform aims to ensure the confidentiality and the authentication services using individually different Diffie-Hellman secret keys for real-time information delivery systems. This paper argues that the world must use the same platform. This paper is also seek to satisfy the system scalability and reduce query reply latency where the platform accommodates a large number of worldwide CDC and the persons in control per CDC. Let's discuss the related works to this particular proposed schemes. Uh, Knowledge of quality and quantity and the quality of the apps uh, related to COVID coronavirus diseases is lacking. Reference 17 proposed sorry Reference 17 performed an observational and cross-sectional descriptive study of all smartphones app associated with COVID-19 between 27 April and 2nd of May 2020. They searched Apple Store and Google Play Store for COVID-19. The search data was classified into following categories: news, general information, self-diagnosis, contact tracing, notification for close cases, awareness, helplines, monitoring of the clinical parameters, recording of symptoms and treatments, messaging with healthcare professionals. They concluded that the app's most common purpose are providing information on the number of infected, recovered, and decreased patients, recording symptoms and contact tracing rather than real-time tracking and monitoring of the COVID-19 cases. The Center for Health Security at John Hopkins announces the national plan to save lives, reducing COVID-19 burdens on the healthcare system, ease restrict social distancing measures, and confidently make the progress towards returning to work and school. They suggested that the United States must implement a robust comprehensive system to identify all the COVID-19 cases and trace all the close contact to each individuals. According to them, if one their according to their estimation, if one person spreads virus to three other peoples, then it comes a total of 59,000 cases in a just in a 10 rounds. And in COVID-19 is already spreading through community across the United States. Therefore, the case-based intervention approaches will be impossible to achieve for the COVID-19 without the national initiative that combines a massive expansion of rapid diagnostic tests and adoption of new technologies to seize the case to to case identification and contact tracing in each state. USA needs some of United States needs two important things to curb the COVID-19 pandemic: the rapid diagnostics test for all the symptoms and their reasonable suspected people, and reliable to trace all the contact reported cases. To accomplish this require goals, the action that the federal, state, and local governments and other organizations must take to stand for these capabilities as quickly as possible. Moreover, the second solution to monitoring and tracking is urgent. Countries are employing variety of means to enable the contact tracing. In Israel, the legislation was passed to allow the government to track the mobile phone data with the suspected infection. In South Korea, government has maintained a public database of known patient, including information about their age, gender, occupation, and travel routes. In Taiwan, medical institutes are were given access to the patient's travel histories, and authorities tracks the phone location for anyone under quarantine. Furthermore, on 20th March 2020, the Singapore government released a mobile app called Trace Together, designed to help the health of officials to track down the exposure after after an infected individual is identified. However, there is a very important privacy implication of the existing search tracking apps. While Singapore's Trace Together app protects the user's privacy from each other, it has serious privacy concerns. The government access to the data, and this can be seen in uh, these privacy issues can be discussed is discussed in reference 23. The appropriate privacy trade-off can be obtained so that people can willingly and endorse the for sake of public health, with the sufficient computational resources, and the cryptographical protocols. Application-based contact tracing can be accom- can be accomplished without completely sacrificing the privacy. This application use is a limited because it relies on direct contact tracing of Bluetooth proximity network without using any location data. Even though they begin to use the messaging system increase uh, private messaging system sorry, increasing the privacy remains a future works. They agree they agree that there is a long way to adopt a contact tracing globally. For example, the scalability of the data structures used in the server may become a major issue when the number of infected individuals and the public users rises. The tracking can use a blockchain-based Ethereum smart contract and Oracle to track and track the reported data related to the number of cases, deaths, and recovered cases obtained from the trusted sources. And it is discussed in reference to 24. The number of such positive and negative test test presents test patients hospitalized, deaths, hospital bed occupied, ventilator shortfall, etc. Allow the officials and public to track the progress of COVID-19 in real time. However, these numbers of pose a major problem, as the decision based on such data are often imperfect and incomplete. Thus, the tracking apps introduction becomes necessary and valuable to prevent the spread of the virus and maintain the data quality and integrity. Furthermore, the valid data is uh, valid to monitor the progress of the pandemic. Tech giants, researchers, and healthcare officials started using contact tracing mobile apps that uses Bluetooth proximity tracing and the geolocation tracking to track down the COVID COVID cases. However, the available online may not be perfect, as it is susceptible to the data manipulation. They argue that the blockchain technology can revolutionize can revol- sorry can revolutionize the way to track the COVID-19 cases. They focuses on the benefit of 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 implementing blockchain-based solution over the traditional centralized solution, including data handling, quality insurance, and fault tolerance. It in because blockchain has a function has a feature of immutability and the data proofness, while removing the single point of failure. However, it has a like it has another issues, like when the data becomes very large, as a blockchain transactions are increased. Every node should have to store and validate store all the validated transactions. This becomes a very big obstacle, as it is because the block size and the time of processing of each transaction is limited. The current platform transaction needed to be processed real time. However, it is not possible to give a priority, or any search of any search type of sequencing to the blockchain system, since the blockchain size is limited and causes some transaction to delay so much. As a result, this increases the latency issues, makes the blockchain based tracking solution is not suitable for the viewpoint of scalability and latency. The latency makes the issue makes it difficult to realize the blockchain-based tracking platforms. In addition to blockchain demands a high bandwidth and the computational resources, and that is very expensive. Therefore, the blockchain-based solutions cannot be completely suitable for the resource-constrained IoT devices as a resource, because uh, because these IoT devices are very limited in resources, and generally all the smart cities has these resources. However, the smart blockchain-based solutions has been tried to solve the security and privacy problems for the medical data, and the modified blockchain model was proposed suitable for the IoT devices to rely on on its distributed nature, and other additional privacy and security properties of the blockchain network. That solution make IoT application and the data transactions more secure and anonymous over the blockchain based network. Blockchain can help create a single database to collect data during the clinical trials and allow the patient's data security. In reference 29, they combine the Internet of Medical Devices applications and blockchain technology in the healthcare for patients' data analysis and research about adequate medication. A remote patient monitoring system using IoT and IoT devices has been proposed. The paper proposed in 29 reference. The paper presents the benefits and the practical obstacles to blockchain-based security approaches focused on IoT and remote patient monitoring systems. In reference 30, they present a holistic vision of IoT-enabled smart communities utilizing various IoT devices, applications, and relevant technologies, which have the potential to be a breakthrough in effort to control and fight against current pandemic situation. The IoT is an emerging field of research, along with the adequate along with the ubiquitous availability of smart technologies, as well as the increased risk of infection disease spread through the globalization and the interconnection of the world, necessitate its use for predicting from the perspective of monitoring and tracking. To prevent the COVID-19, their design is limited to prevent the remote patient monitoring use case within the e-health domain, very relevant to COVID-19 in a home isolation and enforcing the quarantine. It is expected that the smart cities and the intelligent transportation technology will host a range of data-driven services together with deployed sensor to assist early detection of such COVID outbreaks. This This article focuses on the proposing a novel architecture and several use cases that can be deployed to create a smart city and ITS inspired data driven system which can be used to effectively timely enforce the social distancing community measures and optimize the use of resource in critical situations. Compared to several existing approaches to using the technology to control the spread of COVID-19, this paper focuses as follows. This paper design a global platform focusing on monitoring and tracking to prevent the COVID-19. A virtual IoT nodes can be confirmed or suspected cases. CDC forcibly install these virtual IoT nodes in the form of application or on their smartphones. CDC controls the virtual IoT nodes for the list of peoples who need to monitoring and tracking in its control range. SDNC is a centralized center that collects the location information sent from the virtual IoT nodes under all the distributed CDC control. Each IoT node is responsible for updating location information to SDNC. Each virtual node uses a secret key which is created and provided by CDC. Its respective CDCs. Each virtual node uses secret key to update location information to SDNC. SDNC generates and uses the secret key in real time when it receives the update message. CDC can monitor the location information without virtual nodes under its control. Unlike virtual IoT nodes, ordinary user can obtain the limited information from SDNC without a secret key. A ordinary user can reach SDNC and obtain necessary information, expect the privacy related data, even though the user does not maintain any security and any security association with it. Thank you. This is the explanation of the part one of this paper. Thank you.